Drugs and Addiction, an Anarchist Perspective, Dickie Dredd. We're still on Chapter 1, The Drug War on the Mind, and this is Part 7 in the video series and Part 5 in the book, Medicine or Management. Modern psychiatry calls suffering disorder and prescribes order as the cure. It rarely asks what the pain means, only how to get you back to work. Methadone, SSRIs, that's selective serotonin reuptake inhibitors, counselling, CBT, that's cognitive behavioural therapy, all have their moments, but too often they manage rather than mend. They soothe the symptom without touching the source. The clinic has quietly replaced the confessional. Absolution now comes with a prescription slip. When I first went into therapy, I half hoped for revelation, half feared diagnosis. What I got was management. The talk was kind, the pills worked in their way, but the goal was always the same: normalisation, a return to functioning. I remember thinking, if recovery just means becoming useful again to the same system that broke you, maybe this sickness isn't me. Foucault called it biopolitics, medicine as the polite arm of governance, tuning bodies for labour, and obedience. Carr offered a cleaner logic: no diagnosis, no dosage. His easy way said addiction survives on illusion, not chemistry. For nicotine, that's justifiable in my opinion, and it certainly worked for me. But his strict abstinence can sound suspiciously like another commandment. Marte's question digs deeper. Not why the addiction, but why the pain. Where Carr exposes illusion, Marte looks for the wound. Alexander pushes further. When community collapses, people cling to substances, drugs, sugar, gambling, screens, ideologies, anything predictable that takes the edge off disconnection. What we call addiction is often a symptom of isolation. From that angle, most treatment looks like triage for loneliness. Methadone clinic keeps you breathing and rarely rebuilds belonging. Antidepressants lift the floor, but lower the ceiling. Therapy without community is like learning to swim in a paddling pool. None of it is malicious, it just lives inside a worldview where recovery means compliance. As a physicist, I once believed in systems that measured what mattered. Medicine measures what's easy: blood levels, attendance, relapse rates. No metric catches the day someone stops hating themselves. Nutt's work on drug harms showed how far evidence bends to politics, and we'll discuss that later. Psychiatry does the same dance. Research follows funding. Funding follows fear. Real science begins with curiosity. State science begins with containment. Carr's hard line, quit entirely, is one tool, but hardly a universal map. Some substances, used with intent, can reconnect rather than divide. Psychedelic-assisted therapy is showing that it's meaning, not control, that heals. Cannabis can steady anxiety without flattening feeling. Even opiates, under trust, not coercion, can offer dignity instead of despair. The difference is in the relationship, not regulation. Treat the drug as a tool, not a tyrant, and the conversation changes. Nicotine, though, is the exception. Its so-called comfort is pure illusion, a chemical sales pitch to cure the craving it just created. It's capitalism in its purest form. Problem, product, profit, repeat. That's why Carr's total abstinence fits here perfectly. The illusion can't be repurposed, it can only be dropped. An anarchist medicine would start from a different question. What is the symptom trying to say about the system? It would swap sedation for solidarity, diagnosis for dialogue. Healing would be a shared act. Open clinics, transparent research, patients as co-authors, not subjects. No patents on pain. Until that exists, we practice fragments of it. Peer care, honesty about use, refusal of shame. When I look back at my mum's drinking, I see that management stood where meaning should have been. The doctor handed out tranquilizers. The neighbours offered silence. No one asked what she was afraid of. Medicine can't heal what it won't hear. Her story comes next, because it shows exactly what happens when management fails and the human voice goes missing. So the next part we're going to cover is part 7 in the book, which is Mum's Hidden War.